Try once more slideshow. Yes, yes, yeah.
Thank you. Then I'm happy it's there. All right, Chair. I'll discuss the NDOH in particular adjustment budget. And just to give you some background is that initially our planning started in April. We had submissions to the National Treasury at the time. We also had a special forum of CFOs, and we basically presented initially two scenarios, which was an optimistic scenario and a pessimistic scenario. And at the time, the budgets came to about 14 billion and 26 billion respectively. But just to keep in mind that this was an initial stage, and there were some aspects that were not totally costed properly at the time. Some of the HRH wasn't clear yet, and there were some other matters on infrastructure also that we did not have information on. As the DM said, the relief fund was announced on the 21st of April. For healthcare of 20 billion. I think the Minister of Finance eventually allocated 21.5 billion, of which most of it is linked to the provincial departments of health. We also calibrated the model again in May to be in time for the special adjustment budget submission, which was done on the 27th of May. And that envisages a peak in July, August, and September period. So, Chair, you would agree that this is a moving target to some extent, and the budget is as in and when at a specific moment in time. Just to give you some further feedback, we presented to the National Treasury a total summary budget of about 37 billion. And you will see on the left-hand side, these are the elements that we included in the budget at the time, which was the PPEs on Port Health, the ICU beds, surveillance of NICD, thermometers, isolation, oxygen, beds, pharmaceutical, some surge capacity, the issue of the Cuban brigades, the PHC staff, communication, COVID technology, some on MBOD, on the testing part, construction and infrastructure, as well as some mortuary. So that essentially came to about 37 billion that we requested at the time to the National Treasury, or that we put forward, and that was a sector request to the provincial treasury. The funding that came through amounted, and with our reprioritization of our total budget to about 3.4 billion. If you look at the funding that was preliminarily allocated by National Treasury, you will see that there was PPEs allocated as a buffer stock to the National Department of Health, some funds on the Port Health, surveillance on NICD of 96 million, which is going to be part of a transfer payment at national for the Cuban brigade, 41, almost 42 billion allocated, for communication 50 billion, and for our COVID technology, which includes track and trace solutions and other solutions, we've allocated 38 billion, and then a field hospital of 200 million. The National Treasury funds through reprioritization to the provincial departments of health included PPEs of 633 million, but I have to say that this is not necessarily new funds, as there was some reprioritization within the HIV/AIDS and other programs of conditional grants that affected this. The allocation of the 3.4 billion would go to conditional grant funds, and provinces would have the option until the end of, I think, July to submit business plans for this conditional grant, which we would then consider. And having said all of this, the allocations that provinces would probably allocate might differ from what is here. This was the initial proposal by the National Treasury. So to your right-hand side, you will see that we did the reprioritization of in the HIV budget, for instance, of 604 million. The Cuban Brigade was an earmarked fund by the National Treasury for this program of 283 million. And then the additional allocation to provinces with about 2.5 billion. And about 2.5 plus the 23. That was the additional allocation by the National Treasury. And this additional allocation would form part of a COVID component within the HIV grant budget. This would then be subjected to a business plan, and we would expect provinces to submit business plans by the end of at least July, after they've also got their own allocations back from their provincial treasuries. So, Chair, just to say that the need is much bigger than what the allocations are, and provinces obviously would have to further reprioritize within these existing budgets as the pandemic unfolds. Just to go through it, that we have the NDOH adjusted budget, the reprioritization, the earmarked funds, priorities for COVID-19, and then the additional component to the HIV allocation. Just to go through it, the baseline,
Chairperson, sorry, Ian, I'm not sure whether it's only my screen which is not moving.
for COVID-19.
If other honorable members' slides are moving, it's fine. I'll have to check what's the problem with mine. I'm just checking whether other members are not disadvantaged as well.
We are moving.
We are moving, Deputy Minister.
Okay, it means there's a problem with my gadget. Okay. I'm just checking whether.
All right, Chair. Let me continue then. So the baseline budget, as was published initially at the start of the financial year on the 23rd of June, was 55.5 billion. The allocation earmarked for COVID amounted to 5.5 billion at national department, of which 2.6 was reprioritization within existing grants and within the existing voted funds of the National Treasury, and then the once-off allocation for COVID-19 to the National Department, which would mostly be under conditional grants, amounted to 2.9 billion, and the new baseline that will be published for these special adjustments would be then amount to 58.4 billion for the financial year. We understand that there would be the normal adjustments still during the period of September and October, and that would give us further opportunity to reprioritize further if the need does arise at the time. As we said, that the reprioritized towards COVID-19 was 2.6, and the additional once-off allocation was 2.8 billion, or 2.9 billion, but 96 million of that was earmarked for the NICD, would then form part of the transfer payments to the NHLS. Just to show that the focal areas that will be funded or partially funded through the new COVID-19 component under the HIV grant, there would be a component for the PPEs, the personal protective equipment, the contracting of private critical care beds where needed, and I know that there's been some discussions already with the private sector in terms of the need and the allocation, and some negotiations in terms of prices. The laboratory tests performed by the NHLS also part of the funding, and provinces would have to allocate a budget towards the NHLS and the testing. Although the NHLS has not yet started charging any funds, any expenditure to the provincial departments of health. There's also the issue of procurement of thermometers for the community health workers to assist with the screening, and then the Cuban Medical Brigade. At least in this instance, we feel comfortable that the compensation component of the Cuban doctors have been covered, whilst provinces would take care of their accommodation and their ground transport. This is the funds earmarked at national level would go towards some communication. We've already had some expenditure on communication. So this would then have to take care of some of the existing communication needs and expenditures. As I said, the information community communication technology is quite a big aspect for the COVID-19, and we've invested in a number of solutions and applications, and we foresee that the money allocated will probably not cover the entire solution, as the solutions do develop, and we'll have to see in future budgets how to allocate some further funds to the IT component. We're looking at securing some buffer stock, and we have set out to secure a service provider for warehousing and clearance of stock, and that would be part of the national health budgets. Port Health Services has quite a big component in terms of the expenditure, and we're looking to strengthen that part, especially in terms of the human resources. And then, as I said, National Department of Health also has a component of the Cuban doctors that we will fund from this point. If we look at the next slide, Chair, the reprioritization of NDOH, there's reprioritization within the National Tertiary Services Grant, and mostly that would go towards the allocation of personal protective equipment, as well as on ICU beds. Within the HIV/AIDS grant, 604 million was reprioritized towards COVID-19 activities. Within the health facility revitalization grant, about 1 billion was allocated, and the National Health Insurance grant, 22 million. Just to make the point, Chair, that provinces were requested to do these reprioritizations. So we have allowed provinces to indicate to us which funds of the direct grant they would like to allocate towards the COVID-19 component. On indirect conditional grants, about 538 million was reprioritized, and then from the own voted funds from NDOH, about 101 million was reprioritized towards these COVID activities. The additional once-off allocation, as I said, it was ring-fenced for the Cuban doctors, about 283 million. General funding of 2.555 billion, which would be subjected to the provincial departments and their ability to give us business plans on this, an NICD of 96 million, and that accounts for the total allocation of about 2.9 billion additional funds to NDOH. Just to give you a sense of the reprioritization of funds by the provincial departments of health on direct grants, you will see that essentially 4 grants that were affected. The first one is a National Tertiary Services grant, and provinces have indicated these allocations towards COVID-19. In the Eastern Cape, 35 million. The biggest ones in Gauteng at 140 million. These are funds that they've reprioritized. Within the HIV grant, the biggest reprioritizations lie in Gauteng and Limpopo province. On the health facility revitalization grant, which is obviously the infrastructure and which would take care of field hospitals and to a large extent also your health technology assessments. The biggest reprioritization amounts came from KZN, Limpopo, and the Western Cape. And within the NHI grant, which was looking at the contracting of GPs and doctors, only Limpopo indicated that they would be able to reprioritize funds towards COVID-19. So these are essentially the reprioritized direct conditional grants by provincial departments of health. And we would also expect, Chair, that on each of these grants that there would be amended business plans submitted to be able to take care of the DORA requirements in this respect. On the NDOH, to give you a sense of how we reprioritize funds on the health facility revite component, this is the indirect components. And remember, the indirect component is what we do on behalf of provinces. Funds would be moved to voted funds of 191 million. The COVID component from HIV and AIDS of 29 million, and then the field hospital of 200 million, which would then be the commitment by the National Department of Health. On the non-personal services component of the National Health Insurance Fund, 38 million, as I said, would be moved from the CCMDD allocation, from the ideal clinic component and from information systems. And that 38 million, Chair, as we said, would effectively take care of the ICT solutions, and we'll have to see how to augment that component going forward. On the GP contracting capitation, the total amount of 80 million will be moved towards voted funds to deal with the COVID matters. And then in the voted fund in itself, we've identified about 101 million from the core budget that could be moved towards voted funds, and also to look at the COVID component. We have, in line with the Treasury regulation and instructions, created an additional component or allocation within our standard chart of accounts for the COVID expenditure, and this would be part of that component. So just to look at the priorities from the NDOH point of view, we spoke about communications, we spoke about the ICT, the buffer stock of about 205 million. We would like to access funds and have buffer stock available in case of emergency by provinces, but this would mean quite a large communication with provinces to identify or to make sure that we look at their needs and not overstock on certain items and understock on other certain other items. This would in the main go towards the PPE expenditure, and not necessarily take care of oxygen, which also is seems to be becoming an issue at most departments of health. We spoke about the Port Health Services, mostly on the HR component, on HR of that. The Cuban Brigade, the field hospital that has to be the field hospital that will be built through the infrastructure component, and then the shifting of 29 million under the HIV direct grant for other provincial priorities. Just to look at the HIV reprioritization, this was also done in conjunction with the provinces, 604 million. The funds reprioritized with 29 million, and then a new funding of 2.8 billion would then go towards the component in the HIV grant of about 3.4 billion. So this would be a separate component within our HIV grant. The provincial allocations on this grant, as it stands now, on the HIV component, again, Gauteng and Limpopo, the biggest contributors. The Cuban program, we have allocated, as I said, in this manner for the compensation part of 283 million, and this will be ring fenced. Having said that, Chair, there is also a possibility that as the pandemic moves, that the doctors would be reallocated, for instance, from Western Cape, to Gauteng or to KZN, where the need arises. So this is not a static, and we'll have to. There should be a mechanism in place for us to reallocate funds within this program if need be, as the pandemic moves. And then the additional allocation, mostly to the Gauteng KZN, Eastern Cape, and Western Cape, which is the four provinces with the biggest surge at the moment, of about 2.5 billion, and we will still need, as I said, business plans for these provinces. So just to recap, the reprioritized of 604 is allocated to the same province. So we haven't moved money in terms of the 604 million of reprioritized funds across provinces. Provinces allocated within the same grant. The Cuban Brigade is based on the numbers allocated by province. The two variables that we used for the balance of the allocation of the 2.5 billion was mainly the uninsured population, and we took some National Treasury advice on that, as well as the transmission rate. And these variables were weighted at 70-30, respectively, and that also accounted for the division by by province. We are awaiting at National the final tabling of the special adjustments of provincial treasuries. As soon as we get that, we'll have a sense of how the additional funds were allocated by province. So we haven't got a total view on that at the moment. And as soon as we've got that, then we'll be able to share and advise the committee on how that additional funds have been allocated. As I said, we're still waiting the revised business plans from provincial departments of health. So, Chair, in terms of the NDOH, or National Department of Health allocation, this is the allocations as we've got them, and we request you to note them and to support them, Chair. Thank you, Chair. This is the presentation on the National Department of Health allocation. Thanks.
Yes, here is the member asking us to the special adjustment budget and maybe support it. Now, I'm going to read the names of honorable members who have indicated their wish to ask questions, and then I'll hand over to Honorable Gillian so that she can also add the names and take over through the process of asking questions. In this order that has come to my attention, Honorable Gela will be number one, followed by Honorable Wilson, number two. The third one is Honorable Sokata. Fourth is Honorable Kwahube. Five, Honorable Janji. And then number six, Honorable Ismail. If you can take over from here, Honorable Gillian, and then add on other names that might not have come my way. Thank you very much. Attention. Followed by Honorable Wilson, number two.
Chairperson, I've got Honorable Christians and Honorable Latulim and Honorable Baha. I will add if there's more names. Oh, let me just start from the beginning. It's Christians, Latulim, Baha, and Malek.
Continue with the meeting. Continue calling the members, starting from Anna, Gela.
Thank you, Chair. Can I proceed?
Yes, you may, member.
Thank you very much, Chairperson. Let me first welcome the presentation done by our CFO. As ANC, we move to support the budget as is being tabled before us as members of the Portfolio Committee. We support the adjustment budget for our department, and we are looking forward that all the issues pertaining health hospitals will be addressed. we know that currently we had oversight to hospitals in some of the province. I managed to attend here in Gauteng because I'm residing here. There were issues that were raised during our oversight visit, which is the shortage of staff. As we know that some of the staff members were infected by COVID-19. Although we welcome the issue that also the department has employed temporarily COVID-19 staff so that they can back up or assist the situation faced by hospital due to COVID-19. The other issue is the issue of PPEs. I'm happy that is going to be addressed so that they can have enough PPEs in the hospital. The other one is the issue of ICU beds, which was a really serious concern because as we hear daily that COVID-19 is increasing in numbers and the hospital, they have a challenge of shortage of beds. I'm happy because the budget is going to address that. It's very clear that as a caring government, we are looking forward to make sure that we assist and also we respond on this pandemic because it's a new illness, it's a new thing that we didn't know, but we are learning. But I'm happy because our government is responding positive. The other issue, Chair, it's the issue of reprioritization for COVID-19. The issue of HIV, TB, malaria, the 604,711. If I can just get a clarity there, whether that amount will be allocated to COVID-19. And then the other issue is the issue of emergency construction of 400 in bracket 300 beds wards at selected site in province Department of Health. I just want to know which areas, which provinces, and how many allocation per province. But as the ANC, we are moving forward. We are support the budget adjustment as is being tabled to us. Thank you very much, Chair.
Can I have the next member?
Allocated to COVID-19. And then the other issue is the issue of emergency.
Thank you, Chair, and good morning to everybody and to the team. Ian, you've stated that 21 billion will be transferred to provincial departments of health, and that for this they have to submit a budget or a business plan as to what they are going to do or what they require. And I think I have some concerns around this because we've obviously over the last 3 months seen some issues as far as the provinces are concerned. Certainly as far as mismanagement is concerned, poor planning is concerned. We had 2 incidences this week in Limpopo where ambulances refused to go out and pick up patients, both of whom subsequently died because they had no PPE. So, that is an issue for me. 21 billion is a lot of money, and we're in a situation now where under no circumstances whatsoever can 1 cent of this go anywhere where it's not supposed to do. We are in the middle of a crisis. And you're saying that this will go in the terms of grants. Okay, now, are the provinces being given some idea, or have they been given a set of protocols around which to work as far as they are concerned when they're doing the business plans for this? We always have a concern. We find that in some of the provinces, huge amounts of grants are going towards staffing components, that creates a concern. We've got severely short of emergency personnel. We've in the country as a rule, 1 ambulance at the moment is being required to cover 21,000 square kilometers. we are sitting in a crisis now where ambulance and emergency personnel are going to be a priority as this pandemic comes to the fore more and more. What are we going to do about that? I'm not advocating for central funds, but what I am advocating for, please, is can you give us the assurance that those provinces, when they submit their health plans, have been given a set of protocols or an idea of what it is they must include in this money, because we cannot have money at this time misallocated to things that are not essential at this particular period in time. Thank you, Chair.
Member Sokatsa.
Thank you very much, Chairperson. Am I audible?
Yes.
Very much, Chair. Let me also thank the CFO for the good presentation that he has given us. And I think as the African National Congress, there's no way that we should not support this budget. This budget, I think, will make sure that the department carries on with the good work that they are doing in terms of making sure they are fighting this pandemic. My question, Chair, is around the infrastructure grant. Given the history of spending of provinces on this grant, either on their own or by the Department of Public Works as the implementing agent, I just want to check the CFO. In his view, will provinces be able to spend these reprioritized funds? And if not, what is going to happen to these funds? Will they be surrendered to Treasury, or will they be readjusted in the department's budget? Thank you very much.
Thank you, Member Sokatsa. Member Kwaobi.
The department carries on with the good work that they are doing in terms of making sure they are fighting this pandemic. My question, Chair, is around the infrastructure grant.
Sorry, good morning, everybody. I apologize, I was on mute. There's actually just one concern which is underpinned by a number of them, but just one particular concern that I have. The president announced that there would be a 20 billion or 21 billion rand allocation to provinces to fund their health responses. Now, Minister of Finance 2 weeks ago came to Parliament essentially to state that a large portion of that money is actually money that already exists and that it is not new money, and that provinces in effect would have to reprioritize existing budgets to fund their health responses. And Ian did allude to this in his presentation, that in fact this is almost the repurposing of conditional grants in the provinces. Now, the assumption from the provinces was that they would obviously be able to reprioritize whatever money they've got in their provincial budgets, but they would also be allocated in an equitable shared fashion money that would be coming to them to augment their response. And provinces were obviously expecting that money, but now it seems as though they've been sent back to go and find the money to fund the response. So if Ian can provide clarity here, please, that how much money in rands and cents is being sent from Treasury and the National Department to the provinces themselves, and how many for COVID response? Because from what we can see here, there's also a grouping of a package of services where there is almost a conditional grant for HIV, for malaria response. How much of that is actually purely a COVID response? Because ultimately, if we are not funding the provinces equitably and properly, we're not going to be able to get the things that we need from them to be able to fund this health response. SLAs have yet to be signed. What is the hold up with that? Why have we not signed SLAs when there are hospital beds that are now no longer available to certain people in certain parts of the country? This has been going on and has been coming for weeks, and it's not clear even from your presentation what the hold up has been. There are certain provinces that have not built field hospitals as yet. The Eastern Cape only has one, and they haven't actually rolled that out despite their numbers climbing. And in addition to provinces not being given the requisite funding, they're also expected to fund a part of the Cuban doctors program. Surely, this requires some kind of revision between yourselves and Treasury.
Thank you, member. The next member is member Ismail.
What is the hold up with that? Why have we not signed SLAs when there are hospital beds that are now no longer available to certain
You
people in
forgot
certain
Honorable
parts of the country?
Janji, but she
This has
can
been
come
going
after
on and has
Ismail.
been coming
Okay,
for
thanks,
weeks, and it's
Chair.
not clear even from your presentation what the hold up has been. There are certain provinces that have not built field hospitals as yet.
Can
The
I come
Eastern
in,
Cape
Chair?
only has one, and they haven't actually rolled that out.
Chairperson, can I proceed?
You can proceed, member.
Thank you very much. Chair, good morning to the members. And let me join you in appreciating the presentation. Chair, some of the questions that I would have asked
Thank you, member.
have already been asked, but I've got this question that South Africa has a long-standing relationship with Cuba, which was pioneered by the two presidents, Fidel Castro and Madiba. And we have been sending students to Cuba, and Cuban doctors have been coming to South Africa, which is something that we welcome. We note the budget allocation to that line item. But there's an expectation from South Africans that Cuban Brigade should support us free of charge. Can you explain why there is that expectation? Yet Cuban doctors have been coming to this country and have been working and have been remunerated. Why is it now that there's this brigade, there's another expectation? The second thing I want to ask from you, the CFO, we've just heard from WHO that there's a gross shortage of condoms. How is our country affected? How bad is the situation? Because as we deal with the COVID-19, we do not want to not to look into other ailments that are in the communities. We want also that our communities should be taken care of. Thank you very much, Chair.
Thank you, member Muniai.
Thank you, Honorable Chairperson. But before I make my point, I think it is very much important that let's not misrepresent the Honorable Minister, Dr. Zweli Mkhize. He is not the budget, it's not even here. So we have to deal with the budget presented by the CFO. This issue of trying to misrepresent him and play political dynamics here in the gallery will not work. But the second point that I want to deal with, before I even make my point, this attitude, anti-Cuba sentiment, doesn't understand the benefit for Cuba has made to the liberation of our country. It's worrisome. In Cape Town, there's no way the budget will be the same. The provinces are not the same. The dynamics are not the same. This issue, I think Western Cape, what they must do, they must mobilize, they must provide, they must mobilize leadership to get their people quarantine, testing and quarantine. They can't just leave people moving ups and down as if they can't provide, then they argue for money. No, my point is, Chairperson, I think I will appeal that in the next budget adjustment, please consider raising the funds for NHI because it's a game changer, it's the equalizer, it can resolve our current problems rather than the current two-tier systems, the one for the rich and one for the poor, one for the public, one for the private. So this issue Thank you very much.
I think Western Cape, what they must do, they must
I
mobilize.
support the budget 100%. Thank you.
Get the people quarantined.
Chairperson.
Thank you, member.
They can't just leave people
Yes.
moving ups and down as if this.
Chairperson here.
But then they argue for money. No, my point is.
Yes, member Chabaleng.
Can we put in Chabeleng last because there's a list of members sent.
Okay, sure. It's okay.
Yes.
Honorable
All right,
Because it's a game changer.
I move now to member
System
We
problems.
can resolve our current problems rather than the current two-tier systems.
Thank you very much, Chairperson. My concern is about the huge reductions in the building and infrastructure, which, if I have it correctly, is 220 million. Now, provinces have the discretion to spend their reprioritized allocations at their own discretion. Is there any concern that the expenditure will be done correctly and to the advantage of the people in the provinces and according to the specific needs, because each province's needs differ? Now, especially in the Northern Cape, hospitals are in utter disrepair. Recently, we did oversight at a quarantine site and a hospital site in Namaqualand, and they only had 5 rooms, there were no beds, and there were no windows in the building. So what how can we assure that provinces will see to issues like that? What oversight and accountability will they be held to account for, and how will National hold them responsible? And my second question is the reduced amount of 604 million for the HIV/AIDS and TB component. Now, it was stated that this is due to the slower uptake in the antiretroviral treatment program. One of the members have already mentioned the shortage of condoms, etc. Now, how will this impact, or has the department modeled the potential impact on sexually transmitted diseases? And this includes HIV/AIDS as well as unwanted pregnancies. Now, what will the long-term impact of this be in the future? Has the department done any feasibility studies on this, and how it will impact the country as a whole? Thank you, Chairperson. Will they be held to account for, and how will National?
Thank you, member Latuli.
Thank you, Chairperson, and greeting to everyone. As the presentation by the CFO on adjusted budgets, one would have expected that the CFO will go into details adjusted budgets. One member spoke of 21 billion, not trying to repeat what other members were saying, but the 21 billion that is being allocated to provinces is not clear on what is going to happen. I come from KZN and I know a lot of hospitals that are short of PPEs, so it doesn't really say.
Done any feasibility studies on this, and how it will impact the country as a whole? Thank you.
Thank you, member Latuli. Switch off your video.
1 billion, how much in each province? And what can you hear me?
Yeah, now it's better.
Okay. And also, I would have expected that the CFO tells us about the 2.9 billion that is additional. Whether is it going to be sufficient for the department's plans to deal with the COVID-19? And also, in KZN, Chairperson, we have learned that a number of infected healthcare staff on COVID-19 has increased. So I wanted to know what support are they given in terms of mental health, stress, and trauma. And lastly, I would also have expected on the presentation for the CFO to be clear on instance of corruption, whether have any corruption been uncovered and what is being done about it. So it is not clear on all these things that I'm asking. So the adjusted budget is in front of us, but there's a lot of questions that needs to be answered that are not clear. Thank you.
We have learned that a number of infected healthcare staff.
Thank you, Member
of
Latuli.
COVID-19
We
has
move to Member
increased.
Baha.
So I wanted to know what support
Thank you, Chairperson. Let me also welcome the presentation by the department. Firstly, Chairperson, I think I must just make a point that I think members are not misrepresenting the minister in this meeting. In fact, it's clarities that are sought in terms of the budget that is brought before us. And secondly, no one questions the presence of Cuban doctors in South Africa. In fact, the Western Cape did accept the allocation of doctors in the Western Cape, and they are working there. So I'm saying at times when you try not to politicize something, that's when you get deeper into politicizing it. Getting to the actual presentation, Chairperson, I just have two issues that I want to raise. One, to what extent is the department playing its part in guiding provinces in terms of the prioritization? I'm asking this question in the line of looking at the shortage of staff, for instance, across provinces in dealing with COVID-19. How is the department providing guidance in addressing such areas? But secondly, we've seen that money has not been going where it's supposed to. How is the department ensuring now that whatever allocation or adjustment is provided to provinces is mainly used for what it is meant for? The second and last one, Chairperson, is around the training of emergency personnel. I think that there's been an issue where even ambulance operators are not certain of whether to assist COVID-19 patients, etc. How is that addressed, or is that left upon provinces again to decide on how to deal with the allocation that is given to them? Thank you, Chairperson.
Thank you, Member Baha. We'll move to Member Maleka.
Money has not been going where it's supposed.
Thank you, Chairperson. I appreciate the presentation by the department and support the budget. My issue, Chairperson, I want to check how will the programs for women, children, and adolescents in health, WC, AH, be impacted by this budget proposal? And the other issue has been touched. I was about to check about the human brigades, that how long are they contracted to be in the country? And my last question, Chairperson, we see that the NICD would be receiving an additional 96.7 million. How will this be spent? How does surveillance and control entail?
Thank you, Member Baha. We'll move to Member Maleka. Thank you, Member Maleka. Is Member Ismail back? Member Ismail.
She called and said that she is covered and she's experienced
Thank you. And we move to Member Chabaleng.
Thanks a lot, Chairperson. Most of the questions, Milish, I wanted to address are already addressed by other members. I just want to find because I'm actually worried about the metrics, the contribution that is done by Cuba in the fight against the pandemics all over the world. Of course, Honorable Baha explained it that they accepted Cuban doctors, but it's like you're doing people a favor. We accepted them. What I want to check is how many students are taken by the Western Cape government to do medicine in Cuba. I understand there was a kid, a young person who was. But I'm asking this question because there's life after COVID, that we need more doctors after this. So I want to check how many students are trained in Cuba from the Western Cape. And if there is information about these students who was encouraged to leave Cuba because of some ideological something, I'm not even sure. What is the progress with that? Otherwise, I don't want to repeat what other members have said. Thanks, Chairperson. Accepted Cuban doctors. But it's like, you're doing people a favor. We accepted. The budget is supported. We need this budget to have a movement forward. Thanks. Taken by the Western Cape government.
Thank you, Member Chavaling.
I understand there was a young person who was. I'm asking this question because there's life after COVID, that we need more doctors after this. So I want to check how many students are trained in Cuba from the Western Cape. If there is information about these students who was encouraged to leave Cuba.
May I ask one question, Honorable Chair?
Something I'm not even sure. What is the progress?
Yes, continue, Dr. Lomo.
Yeah, thank you very much. And it's probably directed to Professor Glenda Gray. We need to be given some comfort that we are going to be end of this month getting out of our winter season. And we know that this virus is almost a flu-like, and therefore in August we should be having less and less flu. Should we be expecting less and less COVID from the scientists? What should be the hope that we can give to some of us if we continue in this trajectory of really doing the best in terms of the protocols? Because there are various information coming in as to when are we going to be really over this peak. Thank you very much.
Yes, continue, Dr. Lomo.
Yeah, thank you very much. And it's probably directed to Professor Glenda Gray.
Thank you, Chairperson. Mine is very quick, Chair. If you will allow me, I just need to know from the department regarding the issue of the transportation of the patients, as I think our EMS system is not adequate, and now it is being addressed within this adjustment budget. Then, Deputy Minister, the issue of tracing of positive cases is still a challenge throughout the country. And the issue of the isolation areas is a problem because there is some families that can't go into isolation because of there's not enough space. Or the other issue is the issue when we need to assist the community to go into the sites. I think there is still a stigma on when positive patients also had to go to the quarantine sites. I see in the adjustment budget there is money being allocated to the advocacy process, and how far is the department in really rolling out the process of advising people to go into this sites when they are tested positive. But from my side, Chair, I think let's agree on this adjustment budget. NCOP, ANC members is in support of the special adjustment budget. I will hand over to you now, Chairperson.
Thank you very much. Let's send it back to the Deputy Minister and his team to lead us on the clarity and the questions that have been asked. Thank you, Deputy Minister.
Thank you very much, Chair. I'm going to keep the video off just to hopefully improve the audio. because the network does become a challenge. Thank you very much to the honorable members for the questions and comments. I'll just respond to one or two issues, and then I'll ask the DG and the team just to decide who's going to deal with what aspects. Firstly, let me deal with just the last matters raised by Honorable Gillian to say that indeed part of the major challenge in terms of where we are as the pandemic is surging, we've already have our quite high peak in the Western Cape. We don't think we're out of the woods. The numbers seem to be coming down, stabilizing, but it's still very high. And we at this stage, we have no reason to believe that the Western Cape is already at the level of tapering down. It's encouraging, but the challenge still remains. As you can see, Gauteng is really at a very high, what Prof. Karim called the flames and the felt fire, almost getting into the felt fire like where Western Cape has been. Now, we are quite conscious of the fact that the matters which Honorable Gideon has raised are quite fundamental. Firstly, as we know, the key, our key mitigation is in terms of prevention, the basics in terms of hand washing, social distancing, wearing of masks, avoiding crowds, cleaning surfaces, and all those. But the next line of defense is that once some individuals get infected, we have to make sure that they are diagnosed, they are tested, and the contacts of those individuals are traced, and those who are tested positive, either if they are not very sick, can self-isolate in their homes, or else if they don't have facilities, must go into state-provided facilities, and the contacts must be quarantined. Now, that's really the key in terms of managing the pandemic and making sure that we don't really get our health services are not overwhelmed, and also that we don't get into a situation where it's a runaway fire. Now, it is clearly a challenge, as we have witnessed in the Western Cape, and now we're working with Gauteng to try and see how this can be avoided. The moment at one of those, once you reach a stage where either because of stigma or because of various reasons of reluctance of people, once you get a low uptake of people who don't have facilities to can self-isolate, not taking up opportunity to be isolated in facilities paid for by the state, then we have a problem, because then it means even though you test and the results come, and there are about 2,000 people who tested positive over the last 24 hours, 1,000 of whom can't actually self-isolate. If only out of that 1,000, only 100 are willing to go into facilities, then it means 900 are actually going to be roaming, the streets and infecting families and so on. So that's really a very key issue in terms of, that's why in the budget, I think the CFO indicated that there is funds allocated for communication, because we are convinced that good communication, mobilization, of leadership at the local level is going to be very key for us to manage this pandemic. So the health department and the healthcare officials and the healthcare workers can only do up to a certain stage, especially in terms of your hospitalization of people who are already sick. But in terms of reducing the spread of the pandemic, it's really communication, and also mobilization of leadership at the local level, so that communities can actually look after themselves. So that's really a matter which the Department of Health across national and provincial can only do as much as providing the leadership and information and mobilizing, but at the end we're going to depend on the community leadership. The next issue which I want to just say a few words on is what Honorable Dr. Janji raised about the expectation in some quarters in the country where people seem to think that the support which the Cuban people and the Cuban professionals are giving to us should be provided free. Now, I can assure members that, in fact, the compensation which the CFO has mentioned, about 23 million, it's really, if you look at the level of skill, experience, the impact which this Cuban brigade are bringing into our fight, if we're to compensate them at the South African scale in terms of grading of health professionals, because many of them, have tons and tons of years of experience, high qualifications, they've been all over the world, and over and above their qualification, a lot of experience, they would be at super specialist level, but the compensation is really at the very basic medical officer level, which is we're indeed very grateful. But we must also appreciate the fact that they've got families, and as they do this patriotic work, internationalist patriotic work for us, it's only correct, as we have done over the years, that we also recognize that and compensate that, because at the end, we would not want to be almost like wanting them to practice slave labor, to say, a poor country which is under blockade, America is blockading, trying to collapse their economy, but they are still ready to go out and help. And if we then expect that when they do come to help, while they've got families, they must look after themselves as well, that this must be free of charge. It's really, I don't think it's very reasonable. So we're very clear from the health ministry side that what we're providing as compensation is really very basic, and we want to urge South Africans to accept that this is what this is just the correct thing to do. Can I then hand over to DG just to see the allocation from the executive members of the department to see who's going to take which question? Thank you very much, Joint Chairpersons.
Thank you very much, Honorable Deputy Minister and Honorable Chairs of the two committees. The CFO will deal with the budget-specific questions. There are a few questions that I'm going to address, and thank you to the Deputy Minister for dealing with some other questions. I think the first one that we really want to talk about is the issue of contracting of the private sector and the signing of SLAs. I must just give a brief background that we met with all the CEOs of the private hospital groups and the private labs, and we've actually finalized the tariff, which would be the countrywide tariff. And provinces are at different levels. The Western Cape is far ahead. We started there because there was a lot of pressure there. And we've actually even earlier last week, we've workshopped all the heads of departments on the master SLA that we will be using. So it's up to the provinces now to move ahead in terms of analyzing the contracts, the SLAs with the private hospitals. Most of the provinces are still not having a lot of pressure. But we know that the Western Cape, Gauteng, and Eastern Cape are working on that. So what the minister has done is actually, in terms of ensuring that there is more capacity in the most affected provinces, especially the Western Cape, we deployed a very senior former head of department to go and work with the Western Cape, and things are moving well. Same has been done also for the Eastern Cape. And one of the priorities for them is to ensure that no patient does not have a bed, whether it's in public or private. So that is the reason. So we're working on Gauteng, as the Deputy Minister has mentioned. We had a meeting with the Gauteng MEC and his senior team until midnight last night, just to also try and say at least we have some lessons from the Western Cape, so we don't want to get in those kinds of receptive, and have agreed on the per diem tariff that we've agreed that we will pay and will review as we move forward. On the issue of the HIV budget cut, I think we must just allay the fears of the honorable members that this has been done quite globally, because they knew that some of the budgets from the domestic fiscals will need to be reprioritized to address the emergency. They've made money available from the multilateral funds, specifically the Global Fund. We've just been awarded an extra 66 million, and we're expecting an extra 200 million in the next 2 to 3 weeks, which will actually relieve pressure to ensure that we sustain the services in terms of HIV, TB, maternal, child, and women's health programs as we move some funds to address those. So those are able to fill in the gaps. But maybe in another meeting we can come and present that fully, how the multilateral funds have come in to actually cushion us as a country as we move forward. Of course, yes, we agree on the issue of psychosocial support services for the workers. There are a number of programs that through our occupational health and employee wellness programs that we have put in place, and we've also worked with the other institutions where they've put together counseling services for our healthcare workers. There's a good program that has been put together by University of KwaZulu-Natal, which yesterday I was linking them up with the head of Department of Health in KZN, but we're doing the same in other provinces where they've developed these services. Same thing has been done by a group of psychiatrists and psychologists and social workers led by Dr. Zingela in the Eastern Cape, just to ensure that we do care for the carers in terms of their mental health and psychosocially as well. In terms of guiding the provinces in prioritization, the CFO will touch on this one, but we work very closely with heads of departments. But also what is important is that for them to get some of the funds in the form of the conditional grant, they need to submit a business plan. And our responsibility before approving those business plans is to ensure that it is actually in line with what the priorities are, and we have a very symbiotic relationship with them. I mean, as late as yesterday, we had a call with them again just to go through some of the issues, and we are fully supporting all the provinces through the National Health Council and the NAC Tech, where I actually meet with the HODs. In terms of the isolation facilities and the quarantine sites, yes, there is a big program that has been put in place, critically working with the Department of Public Works, and also ensuring that those beds are being utilized. But I must mention that we've picked up a snag, for example, in the Western Cape, where we've had a lot of beds, but there was no appetite from the people to use those beds. So we're trying all the other means to ensure that people do actually take up those beds as they are available for use, especially for those who cannot self-quarantine in their particular areas. But we also would like to request honorable members through their constituency work as well to ensure that we are able to actually speak to the communities that this is to the best interest of the country for them to go to these areas to stay so that they don't spread the infection. Because infection is not going to be defeated in hospitals, but outside in the communities. Then the issue on emergency personnel has been noted. The CFO will comment on that one. And I must say that yes, for NICD, I don't think I got the question very well, but I wanted to say that we have a very good relationship with NICD, and they've actually worked very hard to build up the capacity and be able to try meet the demands. Actually, when we started, close to 80% of the tests were done in the private sector. But now we're sitting at a place where we between 55 and 60% is now done in the public sector, and the rest in the private sector. That's how NICD have actually worked hard to catch up. even though we still have issues, of course, in terms of the testing of the issue of global demand and disruption of some supply chain and logistics, but we've been able to address those through a number of initiatives, including the AU procurement platform, which was launched by our honorable president as the chair of the AU, and we've been able to tap into that where there are actually ring-fenced stocks for the African countries, so that we are not disadvantaged when competing with bigger countries. For now, I think I can stop there, honorable members, and request our CFO to take the specific financial questions. Thank you very much. Worked hard to catch up, even though we still have issues, of course, in terms of the testing equipment and reagents.
Thank you, Chair. I'll touch on some of the questions that were asked, and also some of them do overlap. And if I miss any, please remind me. I'm happy to look at those. I think the DG has spoken quite a bit about the HIV. Just to reiterate that the HIV reprioritization would not move out of the HIV grant, but still remains within that same grant. Provinces have just moved it towards COVID-19 activities, but they still have some flexibility in terms of application of the funds within the total grant. We've taken note of the comments on the staff and the PPEs as well as ICU beds. And then just to say, Chair, that obviously our request was much more than what was received by the National Department of Health, and we expected that. But we had to make the case to our National Treasury in terms of our total allocation and needs. And just to say that, again, I want to reiterate that this was the allocation or the need at a certain time. And obviously it's a moving target, and the needs might get more as it goes along. The 21 billion to provinces, we have to essentially get it back from provinces to see what the provincial equitable share allocations were. We provide, from national point of view, we provide grants to provinces, which, as the DG explained, has to come against a business plan. So the issue is not necessarily that SLAs were not signed. It's just a question of business plans that have to be submitted to Treasury after the allocation or the gazetting of the allocations by the National Treasury. Honourable Wilson, the grants are from the National Department of Health. The protocols that were designed go to provinces in the form of guidelines on how to address aspects of the COVID-19. But we have had some discussions in terms of with provincial departments of what their needs should be. So the provincial equitable share expectation is that about 15 billion would then go to to all the provinces combined. The allocation of that, as I said, we will have to wait for the final allocations by the provincial treasuries to the departments of health. We do know that National Treasury has embarked on a total reprioritization of provincial budgets in a whole to find about 130 billion rand within the total allocations of provinces. We also know that provincial departments of health had to contribute to that reprioritization, but the expectation is that they would receive funds on top of what they reprioritize. So in the case of, I think, Eastern Cape, they reprioritized about 700 million, but they do expect allocation of about 1.2 or 1.4 billion necessarily. So until we get that final picture, we would be able to see what the impact is on the provinces and how the 15 billion has further been allocated. On the issue of the infrastructure grant, we don't foresee any under expenditure on this infrastructure grant at all, actually. um, purely because the needs on infrastructure is so huge for the COVID-19. That's number one. And number two is that there has been some considerable commitments as well on the infrastructure grant prior to the COVID-19 pandemic. So provinces would have had commitments, quite a number of them, for existing projects. Obviously, these projects, some of them would need to be redirected or delayed if need be, to look at the infrastructure needed for the COVID. And as I explained, to that extent, many provinces have actually reprioritized funds within the direct grant for the COVID-19 activities of about R1 billion. And the expectation is that that would probably go mostly to the issue of field hospitals, as well as some quarantine facilities, and to health technology assessments. I think I've spoken about the reprioritization of the 130 billion and expectation that business plans have to be submitted to ourselves to take care of that. So SLAs was not the issue. I'm not going to touch on the Cuba matters. I think the DM has spoken about the issue of the Cuban brigade. Again, the issue of shortage of condoms, I think DJ has addressed that to some extent, but just to say that the HIV grant has still got components for expenditure on the condoms, and the issue might just be obviously be the supply worldwide on the supply of the condoms. On the NHI funds, although we've reprioritized a number of funds within the current financial year, we have protected the NHI budgets over the MTF going forward. So there's no movement on the funds going forward. We have also, if you look at it, try to protect the current financial year's allocations as well. And for the most part, the biggest impact would be on the indirect grant for infrastructure that would shed funds for the buffer stock, as well as for the building of a field hospital. So that would be the biggest move in terms of the infrastructure grant on the NHI component. Just to address the issue on at the Northern Cape in terms of the health facility revitalization grant, we have seen that the province has allocated or reprioritized, let me get the number, I think about 30 odd million rand towards the COVID-19, 30.7 million rand towards the COVID activities for the Northern Cape. So there's been some movement. If it's enough, that's another question, but it will still be within the province. And the same with the 604 million. As I said, it still remains within the conditional grant of the HIV/AIDS, and provinces will have some flexibility in terms of the expenditure going forward. So what I say that if there's a need at the second adjustment to relook the allocations or the reprioritization within the HIV grant, and provinces will obviously have that leeway and that flexibility within the grant. I think I spoke about the 21 billion. Definitely, we would also like to see what the allocation per province is going to be. The 2.9 billion allocated additional to the National Department of Health. Obviously, it will assist a lot in terms of the grant, but would it be enough? Most likely, it won't be also all sufficient for the needs. And as I said, we put forward a sector need at the time of about 37 billion rand. So together with the allocations to provinces, there would probably still be a need for further funding, and we'll have to engage as we go along, or look at our own efficiencies and reprioritizations continuously within the grant. 2.9 billion allocated. Additional. I'm sure the DJ has spoken about the issue of mental health matters. It will assist a lot in terms of the so just in terms of the spending by provinces and the issue of modeling, I think you would appreciate that there's been certain number of models that have been done to assist with the expenditure and budgets. And in fact, our initial budget submission, and to a large extent our second submission, was based on modeling done with the consortium. And we also understand that many provinces do have their own modelings within. So the extent to which we assisted with or guided provinces with reprioritization essentially went towards the modeling of the disease and the prevalence of the disease within provinces. In terms of funds not going where it's intended to, that's always a risk that is there. We have a strong presence of the AG at the moment within the health sector and also at provinces. We believe, or we hope, that with the conditional grant allocations and with the expectation that business plans would be submitted, that we would be in a position to evaluate those business plans to make sure that the funds definitely move in terms of where it's intended, and secondly, to monitor the expenditure as it materializes. The matter on the NICD allocation of 96 million, we in fact do have a breakdown of that budget, and I can run through it briefly. There's items for consumables, for contingency funds, for human resources, for laboratory equipment, for PPE, for IT, for communications, and then other operational expenditures, which comes to the 96 million. The biggest amounts under the 96 million goes to consumables at NICD of about 30 million, contingency funding of 20 million, and human resources of 19 million, which would then be allocated back to the NHLS. As I said, Chair, that NHLS has not built provinces as yet. They've received some grant funding from Solidarity Fund, but indications are that the cost per test is around 400 Rand. And although within the reprioritization or the funds allocated by National Treasury, we do make provision for expenditure on testing, provinces will have to do the breakdown in terms of their current volumes and their current needs. In terms of how many students from the Western Cape, from Cuba, I'm not sure if the DM has responded to that. Chair, and if I'm not mistaken, I think I've addressed most of the issues, unless I've missed some of the salient points on the questions. Thank you, Chair.
Chairs, when you want me to respond to Dr. Blomer's Chair Dr. Blomer's questions, just let me know.
In terms of their current volumes and their current needs. In terms of how many students.
Okay, go ahead. Can you and respond to this?
Sure. You ask a very, very hard question. So the coronavirus usually circulates for 2 or 3 seasons. And so when a new coronavirus arrives, we can expect it to be in circulation for 2 or 3 seasons before it circulates out. This coronavirus is very, very contagious. And we, first of all, thought it only was spread by droplet spread. When people cough and you've got lots of droplets, the virus is in the droplet, it falls on the ground. And so initially we thought that you could get it through droplet spread and through
touching surfaces and rubbing your eyes and your nose. But just recently, there's been reports of it also being airborne. So the issue of ventilation becomes very important, particularly in congested areas and in areas where you're reconditioning air. And there have been evidence of the virus being spread through ventilation. We heard in China where in a restaurant people sat lower down to the air conditioning and were infected, and in some areas, in some close areas like churches where singing has propagated the transmission. So that's why the issue of masks is very important, and that masks should be used as much as possible. And the importance of non-pharmaceutical interventions like distance, physical distance is very important, as well as washing your hands. So those are the reasons why we need to implement the non-pharmaceutical interventions. So you asked how long will this last for? So we've seen in Northern Hemisphere countries that have gone through winter and are now going through summer, like the US, they continue to peak. And so when we thought the US had peaked and it couldn't get worse, in fact, it's getting worse. And now they're having, you see every day, more and more infections from 20,000 to 35 to 50,000 just recently. And that's because there's non-compliance with masks. We see in Texas, people not wanting to use masks. And we also see when people congregate together, you get more evidence of spread. And so that reinforces the need for the non-pharmaceutical interventions, that people don't congregate in closed areas and maybe start to congregate in open areas, and to avoid crowds and to make sure that we keep our places open, and maybe even churches should be in outside areas or in very well ventilated areas. And it's very hard because obviously it's winter now and taxis have their windows closed, and so it makes people in congested areas even harder to protect people. And so it is possible that if we could get taxis to keep their windows open when they are driving, and maybe even some people have suggested face shields in taxis, because if there's a spray onto your face, the face shield will be better. Face shields are around 20 Rand at some of the chemists, so it may be an affordable intervention for people who can't afford to avoid crowds. May be important. And so I think in terms of when's it going to last for, it's going to be with us for a long time unless we have a vaccine. And so what we have to do is look at ways of trying to keep our hospital beds open. And we've spoken about trying to limit our emergency rooms being full because of alcohol. So we do need alcohol control, and possibly when accidents happen, particularly alcohol-related accidents, we see that happen in the evenings. And so maybe a curfew may be important to try and keep our hospital beds open. I think it's important to know that South Africa, in terms of our case fatality rate, it's around 2%. In some provinces, a little bit more, obviously, as hospitals get congested. But so we have a lowish case fatality rate compared to the rest of the world. And maybe this is because we're learning, as we're learning about new interventions as things emerge in the developed world. We have seen a reduction in mortality in private sector by 25%, and that's an important thing. From the beginning of the epidemic until now, there's been a reduction in mortality by 25%, and that's because people are using high-flow nasal oxygen, they're using anticoagulants, and they're using dexamethasone in the right way. What we have to make sure is with high-flow nasal oxygen, we need to make sure that it uses a lot of oxygen. So we need to make sure that our CFO is making sure that there's not going to be any interruption of our oxygen supply in the country. For people who have to stay at home, have to self-isolate at home, and people who are elderly and have comorbidities and who are isolating at home, we have to make sure that we are watching their respiratory rate and their oxygen flow. And I think one of the first indicators that you need to go to hospital is when when you start to have problems breathing and your sats, your oxygen sats decrease, and maybe pulse oximeters are important as well for people who can afford them and who have to self-isolate at home. Having a pulse oximeter, you can buy them at chemists for between, depending on varying, but around plus or minus around 500 Rand in that region. I know it's expensive, but for people that are self-isolating and have got some money, having a pulse oximeter is an important thing to help you monitor at home. And so I think that as we learn, we're learning every day about this epidemic, and as we learn, we'll get better at managing the cases in the hospital, and we'll get better at managing people who are having to isolate either at home or in facilities. And so I think for us, Chair Dr. Glomer, Chairs Dr. and Chair Dr. Glomer, we have to make sure that we implement NPI. And that's why the communication is so important, is that people understand why we have to wear masks. We wear masks, so if we do talk or if we do mask, we have to also make sure that we ventilate places where there are crowds, and we also make sure that we try and avoid congestion where possible. And so so I wish that this coronavirus was circulating out by November, but if we look at even the US, I mean, they're now in summer, and they are actually having even a worse epidemic than ever before, and we've seen resurgences of this in other parts of the world. And so we're just going to have to try and implement the NPI until we get vaccines or other interventions that can manage the onward transmission or to treat the COVID infection that we have. So so I think I think the adjusted budget's important because we need to strengthen our health system. It's also important to note that every health system at a global level has been affected by COVID-19. It's not just South Africa. So it's important that we allocate resources to fight this epidemic. Thank you very much.
Thank you very much. Just the question which Honorable Chaveling had asked about whether there are any Western Cape sponsored medical students in Cuba. The answer is no. I'm hoping that now that the province will experience the benefit of working with a country like Cuba going forward, they'll also see the need to fund ordinary, poor students who are well deserving, who can go and study medicine in Cuba. So one is hoping that going forward, the approach of the province is going to change, and they will also participate in the program, so that the young people from disadvantaged backgrounds who are academically deserving, who cannot get admission into UCT, into Stellenbosch and other medical schools, can get the opportunity to go and study medicine and also learn more about primary health care, primary healthcare based medical training. So we're hoping that our colleagues in the Western Cape are going to have a different view, and going forward they will be prepared to sponsor our deserving young students from poor backgrounds who can go and study medicine in Cuba. I'll just check with the DG if there's anything left before we hand over back to the co-chairs. DG, if you can indicate.
Thank you, Honorable DM. I think from my list, we have covered everything, unless if the members feel that we missed something. Thank you.
No, thank you very much, Deputy Minister. You missed out on some things that you are not aware of. There are two members who logged in a bit late, challenges of logging in. This second round is only going to prioritize them and not take new questions from the members who have asked. It's going to be Honorable Imam Sheikh and Honorable Sukars, those two who will ask questions. Thank you very much.
Thank you, Honorable PM.
Gillian apparently is now logged off. I haven't seen her. And I know the members of the NCOP have got another plenary that they are rushing to. So maybe you just keep it at that level, the two members only. Thanks.
Thank you very much, Chair, and allow me to apologize for my late joining the meeting. I've just heard an emphasis on the issue of the virus being airborne. Now, I would like the department to tell me their view on this, because that is the argument that we have been having for a long time, particularly with ventilation problems. When the Department of Transport says that it's absolutely safe to travel by air for 2 hours and 3 hours at a time, and yet health experts, even the own national department, have gone on to say that traveling by air is a great risk. And that's the first thing. Now, the second thing is this: I would like to know, what is the department doing about moving to a preventative system? And we know that lifestyle diseases in South Africa is a major problem. Diabetes and many others. What is the department doing? Are they going to be prioritizing budgeting so that we could deal with the challenges we face in the health sector from a preventative point of view, rather than allowing our people to get sick and go to hospital, put an impact on the entire department, on the labor force, on productivity and everything in the country? What is the department doing in terms of dealing with that? Because at the moment, Chair, I want to say, there's a free for all in South Africa, even in the manufacturing of goods. And I'll give you a good example. Diabetes is becoming the number one cause of death in the Western Cape. And yet there are products that are being manufactured, not monitored by the Department of Health. And it's having a massive impact on the health department and in the lives of our people. So that's the second thing that I want to talk about. Now, the other thing is on the one hand, you talk about, and let me give you a good example, TB, and you're talking about 2035 where we want to end TB. What plan and program have you got with the other relevant departments? Because TB is linked to poor living conditions. So are you talking to human settlement? Are you talking to water and sanitation, the socio-economic conditions of people? I believe that there needs to be some joint effort between all the relevant departments, for you as the Department of Health and us, to be able to achieve what we really want in terms of reducing fatalities, but also creating a better quality of life for our people. Now, you talk about infrastructure. I know that there's now monies that have been redirected from infrastructure, but yet we are going to need to spend more and more money in the coming years, particularly with infrastructure, given the fact that lots of our facilities need attention. And Chair, I don't know whether I can continue or whether I'm going to be impacting on the time, because I missed most of it, and I don't really know if I can just continue a little while longer or not.
Let's give Honorable Sukas, you have had a bit of a good bite. Thank you.
Okay, Chair, I just wanted to give the last one and saying, and that is, why is the department, knowing the challenges we face with alcohol, with tobacco, Minister has alluded to the dangers of it, why is the department not going on a communication drive to educate our people on the ground at all levels in the townships and everywhere on the dangers of all these things, so that we can try and contain this virus? Thank you, Chair.
Honorable Sukas.
Thank you, Chair. Appreciate it. I just want to emphasize and I think it overlaps with what Sheikh Imam has said. The big concern is around community transmission. And I just want the department to please indicate how they will upscale community efforts. Firstly, to reach people who live with comorbidities, in order for them to get their conditions under control. And secondly, how through messaging they will reach people at a community level. We have instances now where every sector is overlapping: health, education, social development. And there is a need for greater collaboration around these departments to reach communities with the right messages. Firstly, people that have contracted the disease, in terms of what they need to do in order for them to manage themselves within the limitations, of course, of their socio-economic circumstances, and where and what they can do, like. And secondly, how through messaging they will reach people at a community level. We have instances now where every sector is overlapping: health, education,
Honorable
social
Sukers,
development.
we're still
And there is a
waiting for
need
you.
for greater collaboration around these departments to reach communities with the right messages. Firstly, people that have contracted the disease, in terms of what they need to do in order for them to manage themselves within the
Okay, I'll ask
limitations,
Honorable
of course,
Sukers to
of their
write down
socio-economic
the
circumstances,
remaining part of her
and where
question.
and what they
If I
can
could then
do,
take this back to the
like.
Minister, Deputy Minister.
Thank you very much. Thank you very much, Chair. I'll ask the DG. I'm sure he can deal with the questions from Honorable Sheikh Imam. I'll add if there's anything to add. Unfortunately, I think Honorable Sukers, the only thing we could pick up was on the concern about managing the comorbidities. I'll ask the DG to say something about that, and then if there's anything I can indicate. Over to you, DG.
The remaining part of her question.
Thank you very much, Honorable Deputy Minister, Honorable Chair and members. I'll take some questions, and then the others will be taken by Professor Glenda Gray, because she also sits in the Ministerial Advisory Committee. So some of the issues that Honorable Member Sheikh Iman raised that she's going to deal with, which includes community transmission, the flights, and the other issues. But basically, on our side, I must just mention that through the NAT joints, the NAT joints is a national joint operations and intelligence center, where all departments meet to drive a coordinated response from all the departments. That is checked by the Secretary for Defense, and that is a technical committee that then reports to the National Coronavirus Command Council. So we actually work as a team. There are different work streams where we deal with issues of water availability, dealing with issues of transport. We even have committees that deal with issues of repatriation of people, which will include international the DECO, international cooperation. It will also include Home Affairs. So there is that work. That is very standard. There are meetings every week, and then we report to the National Command Council to ensure that no department is left behind. So that one, we address it at that level. On the issue of alcohol and tobacco, there is a special task that was put in to actually advise on the effects of alcohol. Especially, we have data from the MRC, and I'll allow Glenda to also talk on this, that shows us that the problems that we are facing in terms of the in terms of clogging of hospital beds after alcohol was reintroduced are becoming a problem. She did mention in her first response, but she can just touch on that. However, on our side, we are actually working on a very robust communication campaign to address all these issues at a community level. Now, on the issue of comorbidities, yes, I agree. This is a problem that the country is facing, which was there pre-COVID. but now it exacerbates the mortality in people who actually contract COVID. So we are running campaigns that will also be strengthening. But more importantly, what the two ministers, the Minister of Health and the Minister of Social Development, have done, they formed a ministerial advisory committee on social and behavior change, because most of these issues are behavior change issues. I mean, if you're looking at the issues of alcohol, it's a behavior issue. If you're looking at issues of diabetes, that's why they are called diseases of lifestyle. So we are ramping up our communication into that. But specifically through the MEC, the two ministers have brought in a number of individuals who are going to drive communication at a local level, at a ward level, but also reaching specific constituencies, including the churches. That committee, the ministers have actually delegated Bishop Mpumlwana of the South African Council of Churches to lead that committee, but it's got all faith leaders, it's got NGOs, it's got unions, because we're really trying to see that if these people are driving this on the ground, whilst we supplement, we actually complement this with with the media campaigns that are ongoing, print, audio broadcast media, to try and reach to the ground. We hope we'll be able to reach that. I think what Professor mentioned is that with non-pharmaceutical interventions, your best bet is just continuous communication. People must wear masks, people must social distance. We shouldn't give up on that constant communication. But also I'm throwing it back to our honorable members, because they have constituencies. We're also depending on them to ensure that this message is amplified as we move to those areas. I will stop there for now and allow Professor Glenda Gray to take in the other questions. Thank you.
Sure. In terms of air travel is very safe. The aircrafts move air from outside every 3 minutes. So that's the first thing. So they replace the air in the aircraft every 3 minutes. Plus the filters that they use are HEPA filters, and these are the filters that we use in operating theatres in hospitals. So in ICUs and in operating theatres where we have HEPA filters. So they use the same HEPA filters in the aeroplane as they use in operating theatres and ICUs. And in addition, the air continually, even though the air is being recirculated every 3 minutes, the air is blown from the ceiling to the floor all the time. And so, in fact, it's probably the safest place to be. What you should be worried about rather is at the airports to make sure that in the airports, in the queues, that you're maintaining physical distance, you're wearing your mask, and you're washing your hands. So it's probably I'd rather travel in an aeroplane than in a taxi. It's probably safer. What's very important, I'm more worried about taxis than aeroplanes, and I do want us to make sure that we try and get the taxis to keep their windows open, even though it's cold. People must just wear more jerseys and blankets in the taxis. It's very important. In terms of alcohol, you're correct. So once we lifted the prohibition on alcohol, we saw two things happen. We saw our emergency rooms and hospital beds fill up, and we saw increase in gender-based violence. And so we've been following the data. We looked at the data during lockdown, and we saw huge reductions in hospital beds during the lockdown, which now have increased. And so our job is to keep the hospital beds open for COVID. And what we have to do is try and prevent alcohol-related injuries. We also see that a lot of the alcohol accidents happen at night. And so, so we have to try and control the accidents that happen at night. And we're going to try and control the alcohol-related incidences like gender-based violence and what alcohol does to our emergency rooms. And so it's quite clear there's a direct relationship between alcohol use and bed occupancy. We need to find a way of protecting the beds so that we can use them for COVID-19. So it's a waste of beds. Any alcohol-related injury is a waste of a hospital bed. and we should be doing, as South Africans, we should be doing everything we can to protect the beds and minimize alcohol-related injuries. And we're going to try and control the alcohol-related incidences like gender-based.
Thank you very much. The last from me, Chair, is just to say to the Honorable Sheikh Imam that indeed our approach is primarily a preventative approach. We're not yet there to the level of Cuba, for instance, in terms of the way we focus most of our resources. We are still very much spending most of our resources on the curative side, but we're making all efforts to make sure that our primary health and our health promotion and prevention of disease can actually be more and more strengthened. And the more we move into the implementation of the NHI, the stronger we will be in terms of a much more strong and focused approach on prevention and promotion of health and prevention of disease, and a very primary health centered approach. That's exactly where we are going. Thank you very much, Chair. I think from our side, we are done. Thank you.
Yeah. No, thank you very much. I'll read the question of Honorable Sukas, though it is not really a health-related matter. It is a workplace management that is fundamentally addressing the issues of a National Command Council. He's asking a question why factories remain open with reported cases of infection with COVID. Now, that is beyond our focus as a health. But if there are members who would allow, who would actually answer, that's it. Let me then say before that, honorable members, between now and next week, you probably are aware we'll be calling you to then indicate your party interests and your party comments on this special adjusted budget, which will be a meeting next week. It may not be a very long meeting. I'm tempted to say in that meeting, we invite Professor Glenda Gray and her team, because I have listened to them in another platform where they were talking about this impact of alcohol on health programs. Now, we can invite her here now if we agree that maybe the first hour we'll spend it on our budget adoption or comments next week, and the other hour we'll spend it on the presentation that will be made by Professor Glenda Gray. Please comment on that after I have allowed Deputy Minister to comment on the question of Honorable Sukas.
Can I ask the DG the issue of workplaces? The question is, from my understanding, that workplaces where people have workers have tested positive remain open. I think there is some protocols from labor, from the net joints. I'm sure DG can explain that. Over to you.
Thank you, Honorable Deputy Minister and Chair of the committee. Yes, the issue is a very contentious issue, but the guidelines are very clear. You don't close the full factory, but you close the section, and then those people that have had contact will then need to go into quarantine. But you don't, I mean, if you have a factory that is a big factory like probably, let me say the university. If it was a section of the university, you close that area, you do the disinfection, you quarantine the people, you test the contacts, and then they then come back to work after a particular period. But I know that some unions are not very happy with that. With us in health, so we have a meeting tomorrow to try and discuss that, because that's what the regulations say so far, that you close that section of the work. Thank you. But you don't, I mean, if you have a factory that is...
Okay.
Thank you very much, Chair. We can hand over back to you. The DG has responded to Honorable Sukar's question. Over back to you, Chair.
Yeah. No, thank you very much, members, and to all the presenters. Thanks to the team that came from the Deputy Minister's side. I therefore want to say to the members, we will be meeting again next week, obviously to consider the adoption of of the report that we are going to put together as a committee after listening to the Department of Health. I also intend to invite Professor Glenda on that day, on the second hour, to do just this. Was a very important program. If there are parliamentarians who must know better about the impact of alcohol on health, it is us. What we do with that is another story, but at least let us be armed with information and take it. So, Professor Glenda, we will invite you next week. The time will be given to you by our secretary. Thank you very much, honorable members. Some of us will log in at 3 o'clock and listening to the minister giving us an update on the COVID-19. Thank you very much. Have a good day. Bye-bye. I also intend to invite Professor Glenda on that day.
Bye-bye, Chair. Bye-bye.
To do just this. Was a very important program. If there are parliamentarians who must know better.
Bye, everybody.
Alcohol